Hi, I'm Larry Mike Renda, and welcome again to this edition of Excelsior Forum and Profiles. And no stranger to the show, and doing part 4 with us is Dr. Vaksha. He is a spine specialist and surgeon, and we're so glad to have him back answering all the questions. Now, on our previous program, we had talked about the back. This time, we're talking about the neck. And the neck is a very sensitive area. Car accidents, falls, everything can affect it, and some of the problems that can develop from it can be really, really serious because it is so close to the brain, your throat, your mouth, and we're going to get into a little bit about that. So some of these neck injuries that happen, the neck can usually take a bit of a beating. It's not a very soft piece. It can take a little wear and tear, but these constant repetitive problems, work we had spoke about last time, bending, looking at the computer screen, very popular. What are some of the things that develop from this on the neck, some of these diseases?
So neck is a very mobile structure. Neck is the most mobile part of our spine, and it does take beating from that movement, and the degeneration that ensues from there can cause problems. Also, on the top of that, our lifestyle, using more of computers and mobile, keeping our necks down, not doing enough exercises, not strengthening the muscles, they can also contribute to the pathologies or to the problems that we develop in the neck. As for any part of the spine, especially like lumbar spine, neck can also develop degeneration of the disc, degeneration of the joints, facets, which can compress. The difference between the lumbar spine and here is, in the lumbar spine there are essentially roots only, but here it's a spinal cord, and it's a very sensitive place. If you get problems in this area of the spine, then the spinal cord being compressed, it can cause problems with your arms, with your legs, with your imbalance, with again bowel and bladder, which are sometimes unforgiving, and we need to take care of them early in the disease process.
Which is shocking because a lot of people would think that if it's going to affect the bowel and bladder, that it's going to be the lower half, not realizing how the spine works, the way the nerves and everything, are routed through the spine. And one of these things that you keep hearing from people is like, my neck hurts, I must have slept wrong, or some of these other things. When is the time to see a doctor with your neck pain?
So most of the people who have these neck problems, and essentially when they have just the neck pain, can get better with anti-inflammatory medications, some heat, some massage, some physical therapy, exercises, and they may not need to even see a doctor. But if the pain worsens, if the pain is not improving in a period of about 3 to 5 days, 7 days, or if it's continuing more than that, they should try seeing their primary care doctor actually. Primary care doctor will evaluate. If there is no danger sign, they can treat them. They can send them to a physical therapy, a chiropractor, maybe some massage on the neck, and that can make things better. But if the person has pain that goes down their arms, some tingling, some numbness, then the pathology, the problem may be a little serious there, and they may need a consultation with a spine surgeon, a pain physician, who can try helping them out with the modalities which are non-surgical and take care of the problems.
Now, when would you go to an ER for a neck problem?
When there is a severe pain which is not controlled by usual medication, then they may need to visit an ER to find out as to what's going on and if this can be treated just with pain medications. But if you have deterioration in your neurological status, if you are developing weakness, if you are developing paralysis, if you are developing worsening tingling, numbness, not able to control your pee or your bowels, then they should immediately go to the ER to find out what's going on. And occasionally they may need to undergo a surgery to halt the process or to revert the process. Sometimes after accidents, after falls, they may develop some acute weakness. They may have fractures of the spine, or they may have stenosis, which is compromising the spinal cord, causing problems. In these patients, a visit to ER will definitely be helpful to find out what's going on.
And again, for the people who are watching it, stenosis is the compression of the nerve again. So what you're doing is, after a while, that nerve becomes so compressed, then it dies, and then there's nothing you can do about it.
Yeah, again, the compression, the stenosis means that the canal diameter through which the spinal cord is passing is decreasing. Sometimes these patients have congenital stenosis, which we never know all the life long till the problem happens. And these patients are predisposed to problems in which because of stenosis, the blood supply to the spinal cord goes down, and when the blood supply goes down, it also develops edema, which further compromises the process, which further compromises the nerve cells, causing problems, again presenting in the form of weakness in the arms, in the hands, loss of dexterity, loss of handwriting, not able to hold a cup of water, dropping things, balance problem, stumbling on things, and not able to control their pee again. So those things are danger signs for these patients.
Yeah, it's loss of equilibrium and tremors too, right?
Yeah,
I mean, it's basically like dominoes. If you don't tend to it and you start knocking them down, you're going to start having more and more symptoms, more and more problems. So, it's very good to get them checked out. If your back pain, your neck pain doesn't go away, then I would say 2 or 3 days if you've had it and it's not going away, it's time to see a primary.
Yeah. So if there are a few days and it's not going away, see a primary care doctor at that time. But if you have developing worsening pain in your arms and your legs, then it's time you may have to see a spine surgeon.
Now, we touched on this a little bit on the last program, was genetics. Now, neck pain and genetics go hand in hand?
Yes, here also the degeneration of disc process, the process still has effect from the genetics also. So also some patients may have congenital stenosis of their neck. So they are predisposed to certain injuries. Even a subtle injury, even a small whiplash injury can cause them paralysis of their body, paralysis of their hands, or the whole body. And these patients are predisposed for any pathologies of their neck.
Now, also, when we talk about the neck treatments, we had spoke previously about the back treatments. Are the back and neck treatments similar? I mean, can you do injections in the neck?
Yeah, the modalities are essentially pretty similar between the two, though they have differences just because lumbar spine is wrapped around with muscles, a lot of muscles and belly and viscera in front. Neck has not much of that in it, but still the modalities are the same. Yes, injections can be done on the neck also, which we do epidural injections, again done by pain physicians, which can help take care of a lot of things, and these patients may not need further treatments in the form of any surgeries, and injections can help them a lot in that.
And again, this is not like, you guys are going to have a 10-foot needle and stuff like that, or, one of the things they used to do in the 80s, talk about spinal taps, with these huge needles. It doesn't exist anymore. The new technology,
Yeah, with technology we have come very easy on these things, and they are easy to do. Outpatient procedures can be done in office sometimes, or in the hospital or a surgery center, and the patients are sent usually back after that within a few minutes or hours after that procedure.
Now, what type of cervical surgeries can you do on the neck?
So cervical surgery in patients who need surgeries can be done either from the front, from the back, and most of the surgeries in the neck are done from the front, as contrary to the lumbar spine where we do surgeries from the back. We go from the front, we clean up the disc. If we need, we clean up the bone also. We put some fillers there in the form of cage or bone and put a plate, put some screws, taking care of the pathologies from the front. Occasionally, patients may have problem from the back, especially patients who have congenital stenosis, or they have multi-level problems, or their neck posture is not the best. In these patients, we try to go from the back, clean up the lamina. Then in these cases, we do also put screws and rods to fuse the spine, because if we take off the lamina, there is a high risk that they will develop complications. So we have to fuse the spine from the back also.
So you can do fusions on the neck then?
Yes, the fusions can be done again from the front or from the back. Though there are certain procedures, then we try to do non-fusion surgeries also on the neck, which includes disc replacements, laminoplasties, micro discectomies, or foraminotomies.
And we had spoke previously about putting those fake discs. That's the only way. I know there's a name for them, but can those be put in the neck?
Yeah, so disc replacement is a very successful surgery for the neck, and there are more patients who are eligible for getting a disc replacement rather than getting a fusion surgery done. Getting a disc replacement helps them to keep their segment mobile, keep the movement of the neck. That helps in decreasing the degeneration which can happen on the adjacent segments, which has been a proven fact after fusion of the neck. So those can be done. In certain patients who have just like radiculopathy of one level, tingling, numbness, and weakness, maybe of only one level, small surgery from the back in the form of rhamnotomy can be done, which we do with a small, which is a minimal invasive procedure we do with a small incision, and these patients may not need any fusion, any surgery from the front, and they do well after that.
So, what type of minimally invasive surgeries do you do on the neck? I mean, you just mentioned one. It has to be more than one.
Yeah, even doing surgeries from the front, we try to do minimal invasive, and in which we dissect from between the tissue planes, so that cause minimal damage to the adjacent tissues. We just go onto the bone, clean up the disc. That's also one of the minimal invasive surgeries. The other minimal invasive surgery we do from the back, as I discussed, is a microdiscectomy for rhamnotomy from the back, which we do using microscope. Sometimes we use tubes for them too, and they have excellent results, very good recovery and very quick recovery.
Now, you mentioned fusion and non-fusion. What's the difference in the surgeries?
In fusion, we fuse the segment of the vertebrae, in which we fuse either two vertebrae or more than two vertebrae. When we do a fusion surgery, we actually making the spine a little stiff. Making that stiff is sometimes needed, but it has consequences in the form of increased movement on the segments adjacent to it, which can cause an early breakdown of those segments, needing repeat surgeries for those segments nearby. Non-fusion surgeries, which we tend to do just to decrease this complication, so we do is retain the movement of the neck at that level, which allows us to help decrease the degeneration at the adjacent levels.
Now, about recovery times, obviously non-fusion recovery times are probably a lot easier to go through than fusion, right?
Yes, because non-fusion surgeries, we don't have to wait till the fusion happens, because we are not doing a fusion, and these patients get better. Once they are better and their muscles have been strengthened with the physical therapy, they can get back to their work as soon as possible. In the case of fusion surgeries, we have to wait till the fusion is advanced to a level when we can allow them usual activities.
Now, is there such a thing as joint replacement for the neck?
Yes, as we do a joint replacement on the knees, on the hips, the total disc replacement is essentially a joint replacement, because this is a major joint of the neck, the disc, and we remove the disc and put some new discs which are synthetically made using metals, titanium essentially, and give them a function of the disc that is already there.
Now, what are some of the home remedies? Let's say you injured your neck, you were playing racquetball or whatever like that. Come home, oh man, 2 days, I slept on it, my neck's killing me. What's the best home remedy to start with first before you see the doctor, before you go to the surgeon?
I think the initial part is if the person can tolerate, they should try taking some anti-inflammatory medications. Advil, Aleve, they help a lot. They can use some ice or heat. Both can help. Actually, acute injuries, ice responds better for acute injuries, but if it has been some time, then heat can also help them. Using a soft neck collar can help sometimes, but it should not be used for a prolonged period, because it just causes atrophy of the muscles, which can secondarily cause problems. So strengthening, once the pain is better, strengthening the neck muscles, doing some exercises for the neck also help.
Yeah, because a lot of people were writing in about that I've been taking it easy for a week with my neck pain, and that's not always the best thing to do, because especially when you're older, when you lose that flexibility in your neck, it's pretty hard to get it back, right?
Yes. So that's why early pain control is very helpful, very needed, and so that they can get back to therapy, get back to strengthening their muscles, so that they can keep the health of their neck as intact as possible.
So if your neck's been hurting you for over a week and anti-inflammatories aren't working, it's time to see the primary, right?
Yes, it's a time to see a primary care physician or a pain doctor or even a spine surgeon. Also at the time when, if you have pain which is going down, radiculopathy, which is going down your arms, tingling, numbness, loss of dexterity or feelings on the fingers, not able to hold things, change in handwriting as we talked, these patients should see preferably a spine surgeon who can help find out what's going on by doing advanced imaging, x-rays and MRI to see where is it compromised, is it possible to treat it non-surgically, and if non-surgical, in what modalities have to be used, and if it is not, then what type of surgery has to be done to take care of the problem.
Yeah, now there was a case where a man went to the emergency room, thought he was having a heart attack because he had the pain shooting down his arm. It was actually a problem with his neck. Now that's something that really can shake you up. You think you're having a heart attack because you're having this pain, not realizing that it could also be your neck.
Yes, so sometimes these symptoms can overlap between like cardiac pain or even some tooth pain sometimes, or shoulder pain. Some patients with carpal tunnel syndrome can present similar symptoms. The physicians usually are able to recognize the difference between the two, especially if they are presenting with acute pain. Ruling out a cardiac problem is of paramount importance. Once they are ruled out, then they can focus on other processes that can cause this. And it's a physical examination by the physician, some imagings, x-rays and MRIs that can help us localize as to where the problem is coming from.
So neck pain can actually imitate a lot of other pains that you would have?
Yes, actually, especially patients who have radicular pain can present either with symptoms of others into this, or others can present with the symptoms of a radiculopathy.
Well, that's really kind of scary too, right? Because the only way you can really tell is, again, by going to your doctor. And some of the tools that you have to work with for neck pain, okay, are the diagnostics to really help you out too. Can you tell us a little bit about those?
Yeah, so doing some x-rays help a lot, but MRI is of paramount importance. MRIs help to know a lot about how the bones are, how the muscles, how the discs are, and if there is any compromise on the spinal canal, on the spinal cord. It also helps us to know if there is any edema in the spinal cord, if any specific spinal nerve is being compressed, and if we plan to do a surgery, what type of surgery is the best for such a patient, where to go from the front or the back, what minimal or maximal procedure has to be done to take care of the pathology completely.
And the MRI is not just the only tool in your toolbox, right? You have quite a
We do other things also. We do CT scans to look at the bony anatomy there, and that helps in our surgery. Occasionally, if a patient has a history of infection or a history of malignancy, we can do other imagings like bone scan to find out if the lesion that is there is either caused by infection or cancer, or if he has other such lesions all over the body or somewhere else.
Now, can you develop osteoporosis in your neck, the deterioration of the vertebrae?
Yeah, so osteoporosis actually involves the whole body, and as it can involve the hip, the lumbar spine can involve the neck. It does have implications on our surgery, that what we do, because if you have osteoporosis, then the chances of failure of any surgery, especially if we are trying to do a fusion surgery or putting some implant, are high. And we have to take that into cognizance also. We do bone densitometries on patients who have to undergo especially a lumbar spine surgery, but also for neck surgery if they are at high risk, like they have been on steroids for a long time or some other drugs which can deplete the calcium from the body.
Now, we also received viewer comments from our last program, and one viewer wanted to know, can neck problems cause difficulty with your breathing also?
It's highly unusual, but what happens is the breathing is a component, is caused because of multiple muscles working in unison. One of them is a diaphragm. Diaphragm is a major muscle for respiration, for breathing, and diaphragm is supplied by the nerve which comes out high above in the neck, which is what we call the C2, C3 and C4 segments. Now, if there is a compromise at that level, which is unlikely but can happen, especially in trauma patients, in accidents who have fractures or dislocations, and those patients can have compromise in their respiratory status. Now, these patients may need respiratory support, even need the help of ICU, and treating these patients is a tricky way to do.
Now, we had spoken a little bit about the surgeries before too. Now, what can we do to prevent these neck problems from happening? They say the best thing to do is stop it before it starts, right?
Yeah.
So what can we do? I mean, exercises every day, or stop repetition?
Definitely keeping yourself fit is the best thing that can be done. It helps in taking care of every muscle and bone of the body, especially for neck. Also, doing some neck exercises help. Other lifestyle changes like not smoking, control of weight, repetitive movements, especially some occupations have a hazard in which it can happen. Car accidents can cause this problem, so those things should be avoided as much as possible.
Now, also a severe blow to the back of the head, right?
Yeah.
And because we hear about some of these elderly people falling forward on their forehead or back, and that just does massive damage to the neck.
Yes, these are the patients who have degeneration in their spine already, or may have congenital stenosis which they never knew, and a sudden injury, even a ground level fall causing a blow to their head, can like snip their neck, in which there may be a subtle fracture, but then the disc may be disrupted. They may have acute compromise of their spinal cord, presenting as just paralysis of their whole body, involving the legs, the arms also, and they may need urgent treatment for that.
Now, the next question that we got from a viewer was really something else. Now, because we know that all the nerves in the neck, can the neck affect the eyes and the ears for hearing and seeing?
That's very unusual, because the nerves that supply the eyes and ears are directly coming out from the brain. So if anyone has involvement of that, then we definitely want them to be seen by a neurologist and taken
Right.
care from, or a neurosurgeon, and they will do probably a brain scan to find out what's going on.
Yeah, so most of the times it's going to be from the neck down,
neck down.
shoulders, arms, legs,
Yes.
everything else. But
Yeah.
the upper half is usually
Upper half is
okay.
usually, and rarely can a neck problem cause tinnitus or dizziness also. Most of the time they are caused because of something going on in the ear or in the brain.
Yeah, because they talk about nerve pinches up in the neck. And, you know, if you feel like just like a dog's neck, too, is your own neck in the back, the muscles are pretty strong. You know, I mean, it's supporting the weight of the head, you know, for most of your life. So I would say that, you know, it's probably rare to get muscle strain in your neck, or is it?
Actually, muscle strains are pretty common in the neck, and as you said, they have been supporting the body, the head movements. But at the same time, if they are not strong enough, they are predisposed to getting fatigued, getting muscle tear or ruptures, micro ruptures causing muscle strain. And then that can predispose to many other neck problems. Again, degeneration gets accelerated in these patients because most of the stress comes onto the bones, to the facet joints, to the discs, when the muscles are not able to function properly.
So if we could summarize most of this and say, when is the time to go to your doctor? You're having this neck pain. When is the time to go see your doctor?
So if the neck pain is not getting better within a few days, using anti-inflammatory medications, using some modalities like ice, like heat, but the person should visit their primary care, talk to them as to what's going on. If the person has radiating pain going down their arms, tingling and numbness, then that's the time they should talk to a primary care, maybe see a spine surgeon or a pain physician. Now, if the patient starts developing weakness, then they should preferably see a spine surgeon. Occasionally, people who sustain fall or who sustain dramatic deterioration of the neurological status, they may need to go to the ER also, or contact a spine surgeon at the urgent basis to take care. Most of the times, the patients are treated non-surgically, but there are certain patients who need urgent surgeries also, apart from the people who need elective surgeries, in which we plan out accordingly. Those who need urgent surgeries are the people who have developed acute deterioration, acute weakness over a span of a few hours to few days. And for them, halting the process which is causing all this is of paramount importance, so that not only that they can get an optimum environment for their nerves to heal after surgery, but also halt the further deterioration.
Now, we had mentioned before about car accidents, and sometimes people get into a car accident, you know, oh, the airbag hit me, stuff like that. They walk out of the accident, they think they're fine. A week, 10 days later goes by, they're starting to have problems with the neck. It's probably recommended that anybody who's been in a car accident should get themselves checked out.
Yeah, anyone who has been in an accident, a car accident or a fall or any machinery accident, if they have a pain in their neck or even back, they should see a doctor, because trauma in itself is a red flag. Other red flags also being patients who have a history of cancer, who have a history of some systemic infection, again, who develop weakness. These are all the patients who have fever more than 100 degrees up at the same time when they are having pain, who have been on medications like steroid for a long period of time, have a predisposition of developing osteoporosis. These are the patients who should see a doctor more often needed if they have any pain in their neck or back.
And again, neck pain doesn't discriminate whether you're 5 years old or 85 years old, correct?
Right. Neck pain can happen to young patients also, as well as elderly. Definitely, any neck pain in children is of concern because they usually should not have any spine pain. So, if any child complains of any neck pain or a back pain, they should be seen by a physician promptly. Youth have less tendency of developing neck pain, but they still can develop more of like disc herniations, processes like disc herniation, and with the lifestyle changes nowadays, these things have increased predispositions, increased incidence now.
And we hear a lot about these high school football players and these injuries that they get, and I know they're trying to prevent them, but some things,
Yeah.
it's a rough sport.
Right, contact sports have their disadvantages. These kids can develop stingers, which may get better by itself. But if they are developing more often, or if there is any weakness involved in it, if it is not resolving when they are on the sideline, then they will need to see a physician. And the coach and athletic trainer are in a very good position to help them direct on these things.
Yeah, because, the thing, not only that, but when you get an injury, like when you're 16 or 17 years old, you figure, okay, I'm fixed up. Till you hit 50, 55, and then these injuries have a way of coming back and biting you again, and that's one of the things that, they have to watch out for. So, take good care of your neck where you can, and, do your exercises and try to keep fit. And if you are having a problem with the neck and it's not going away after a while, like you said, to see the primary.
Yeah.
I'm glad you came back on again, and I appreciate you that we were able to talk again. Hopefully we'll bring you back in the fall, and we'll have some more questions about the back and neck and some of these surgeries. Until next time, I'm Larry Mike Arender for Excelsior Forearm Profiles. We have been with Dr. Vaksha, and you take care, and we'll see you back here on this channel.
I'm Vedant Vaksha. I work with Complete Orthopedics. We have offices in Stony Brook, in Little Neck, and in Babylon, and I can be reached through our website, cortho.org, or through our phone number, 631-981-2663.